Using technology to improve health and wellness is a good thing. Besides greater access to health experts, digital health can make medicine more personalized and precise. I'll talk with United Healthcare's Dr. Patricia Auerbach about the latest health tech.
One of the main goals of digital health is for patients to access healthcare and information at any time, 24/7. And this allows patients to take better charge of their health and allows their providers to stay connected to them even outside of the office and hospital. Over the past years, there are many innovations in this space, including the ability to access health care and services through smartphone and a computer. Patients can locate providers on a smartphone and computer. They can compare prices and services. They can also use wearables like a smartwatch or a patch that can remotely monitor conditions and keep them out of the hospital.
What other technologies are available to people out there who want to improve their health and maintain that healthy lifestyle?
Yes, so there are many examples of other digital technologies that are currently taking place. The field is growing so quickly. We are seeing increased use of wearable devices such as smartwatches and biometric monitors and patches for conditions such as congestive heart failure, diabetes, and asthma. They can remotely monitor heart rate, respiratory rate, posture, temperature, just to name a few things. It's an exciting field, and the technology only continues to advance and get much more sophisticated. Telehealth is a great example of a digital health tool that's been invaluable in connecting patients during COVID-19. It gives providers the ability to evaluate patients without potential exposure risk that are associated with in-person trips in healthcare facilities. And that's so important now in the time of COVID. So historically, telehealth has been used to address minor and non-emergent conditions such as colds, allergies, flu symptoms, and rashes. But recently, however, it's been very helpful with mental and behavioral health conditions, primary care, including routine and even complex issues. So to take advantage of telehealth, the first thing healthcare consumers should do is identify what resources are available. And they can do this in three ways. So the first thing would be to check with their physician or provider group. The second thing would be to check with their health insurance plan. And the third thing would be to check with their employer. Once they've had a telehealth appointment, it's also important to realize that their provider or whoever they talk to may decide that they need an X-ray or blood work, so they may have to go somewhere and actually have a visit somewhere else, a follow-up visit. And then the last thing I want to say about telehealth here is that with the winter coming and flu and COVID, telehealth is really a good first step if someone has questions about COVID or flu. A provider can go over the symptoms very safely and direct them to a safe community testing site, or if they decide they need to be seen in person, they can direct them to a safe facility.
What kind of feedback do you get from people when they do these things, when they're getting involved with telehealth?
So your patients are adapting well to it. So United Healthcare has seen a tenfold increase in telehealth visits this year as opposed to last year. Among telehealth users broadly, 70% said that they would likely use the resources again, and more than 80% said that they actually had their health issue resolved in that first visit. One other positive finding that we're seeing is that telehealth is generally more affordable than inpatient visits. So in some cases, it enables people to access care with little out-of-pocket expenses.
What about people like myself who might be kind of old school and feel like this digital age is making everything a little less personal? I want to see my doctor. I want to know my doctor. I want to, be up and close and personal. And a lot of people feel that way, but that might not necessarily be the case.
Yeah, no, so that's a good question. So there's still certain conditions that you should still go in and see your doctor, but it may be best just to first call your doctor or provider first and decide what is the best place to talk or deal with them, especially with winter coming on and infectious diseases and COVID. And I would ask that, if your provider or physician offers a telehealth visit, don't be afraid of it. It's just a new way to improve your health.
Speaking about advances in technology, one thing I have to ask you before I leave. That ingestible sensors, I've heard about these, and is it a real thing? It's something that you can do now, ingest sensors into your body?
It is ingestible sensors. And I'll tell you what, Terry, you can actually get an ingestible sensor and have a colonoscopy that way. That's been going on for actually a few years. And that technology is emerging and will continue to advance.
Well, that is exciting news. I am excited about the digital technology that is coming to the healthcare field, and I think that people out there should be excited and get on board. For more information on digital health tools that can make a difference in your health, go to UHC.com. Angela.